Hey there, I'm so glad you found this video today. Have you ever wondered if something you're doing every single day could be silently feeding cancer cells without you even knowing it? That helpless feeling when you realize a loved one's cancer might have been growing for years completely undetected? I've seen that look of devastation hundreds of times in my clinic. As an oncologist with over 20 years of experience, I thought I'd seen it all until I discovered this common daily habit that's dramatically accelerating cancer growth in seniors. What's truly heartbreaking is that millions of elderly Americans are doing this exact thing every day, thinking it's completely harmless or even healthy. Today, I'm going to reveal the 5 ways this habit creates the perfect environment for silent cancers to thrive, and more importantly, the simple changes that could potentially save your life or the life of someone you love. This information isn't widely discussed even in medical circles, which is why I felt compelled to create this video. So please, stay with me until the end, because what you'll learn today could be the difference between catching cancer early when it's treatable or discovering it when it's already too late. Before we dive deeper, I'd love to know where you're watching from today. Drop your city or state in the comments below. And if you have any questions as we go through this information, feel free to ask. This is such an important topic, especially if you're over 65 or have elderly parents or grandparents. Make sure to subscribe and hit that notification bell so you don't miss our weekly videos on cancer prevention and treatment specifically for seniors. Our community is growing every day with people just like you who want to take control of their health and protect their loved ones. Let me start by telling you about Eleanor, a vibrant 72-year-old who came to my office last year. She was the picture of what we all hope aging looks like: active, sharp-minded, involved with her grandchildren, and seemingly in perfect health. She did everything right: regular checkups, healthy diet, moderate exercise. But during a routine examination, we found stage 3 pancreatic cancer that had already spread to nearby tissues. Eleanor was stunned. "How is this possible?" she asked me, tears in her eyes. "I've done everything right." What Eleanor didn't know was that her daily habit of taking multiple doses of certain over-the-counter medications for her joint pain was creating the perfect storm in her body for cancer cells to multiply undetected. I had to tell her that this habit, something she thought was helping her, had likely been accelerating her cancer growth for years. That conversation changed both our lives. I promised myself I would spread this information to as many seniors as possible, and that's exactly why I'm here with you today. The truth is that cancer in the elderly often presents differently than in younger patients. The symptoms can be subtler, easily mistaken for normal aging, and by the time obvious symptoms appear, the cancer has often advanced significantly. What makes this particular daily habit so dangerous is that it doesn't just increase cancer risk. It actively masks early warning signs and creates biological changes that help cancer thrive. And the worst part? It's something millions of seniors do every single day, often on their doctor's recommendation. I'm going to pause here for a moment because I need to ask you something important. Have you or a loved one been taking pain medications daily for chronic conditions? How has this affected your overall quality of life? You know, many people feel completely alone in their struggle with chronic pain and the medications they depend on. It can feel like you're trapped between the pain itself and worrying about the side effects of what you're taking to manage it. I understand how exhausting it can be to navigate this balance, especially when you're trying to maintain your independence and joy in life. If you'd like to share your experience, you can simply copy "My experience with daily pain medication has been," and complete it with your thoughts. Even a brief comment can make a difference. Your shared experience might be exactly what someone else needs to read today to feel less alone in their journey. Plus, your comments help me create content that addresses your real concerns and questions about managing health as we age. Now, let's dive into what's really happening when seniors take certain pain medications daily, particularly non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, naproxen, and aspirin. While these medications provide necessary relief for millions of seniors suffering from arthritis, back pain, and other chronic conditions, long-term daily use creates 5 dangerous conditions in the body that can accelerate silent cancer growth. First, chronic inflammation from long-term NSAID use. This might sound counterintuitive since these medications are anti-inflammatory, right? But here's what happens. When taken occasionally, NSAIDs reduce inflammation as intended. However, when taken daily for months or years, your body develops a paradoxical response. Research from the Mayo Clinic has shown that long-term NSAID use can actually increase systemic inflammation by disrupting the gut lining. This allows bacteria and toxins to leak into the bloodstream, creating what we call a cytokine storm. Essentially, your immune system goes into overdrive, creating chronic low-grade inflammation throughout the body. A landmark study published in the Journal of Clinical Oncology found that seniors with elevated inflammatory markers had a 43% higher risk of developing cancer within 5 years compared to those with normal levels. Inflammation is like fertilizer for cancer cells. It provides them with growth factors and signals that help them divide and spread more rapidly. Have you noticed how cuts and infections heal more slowly as you age? This is partly because your inflammatory response is already compromised, and daily NSAID use can further disrupt this delicate balance. The chronic inflammation doesn't cause cancer directly, but if precancerous cells are already present, which is common in aging bodies, this inflammatory environment helps them thrive undetected. What can you do about this? Instead of automatically reaching for an NSAID every day, work with your doctor to develop an inflammation reduction plan that includes natural anti-inflammatories, like turmeric, omega-3 fatty acids, and tart cherry extract. Many of my patients have found that alternating days of medication with natural remedies reduces their overall NSAID consumption by 50–60% while still managing their pain effectively. Remember, it's not about stopping your medication entirely. It's about finding the minimum effective dose and complementing it with other approaches. The second dangerous effect of daily NSAID use is immune system suppression. Your immune system is your body's natural defense against cancer. Every day, it identifies and eliminates potentially cancerous cells before they can establish themselves. However, research from the University of Chicago Medical Center has demonstrated that daily NSAID use for more than 6 months can reduce natural killer cell activity by up to 38% in elderly patients. Natural killer cells are your frontline defense against cancer. They recognize and destroy abnormal cells before they can grow into tumors. This is particularly concerning for seniors whose immune function is already declining due to age, a process called immunosenescence. When you combine the natural aging of the immune system with the suppressive effects of daily NSAIDs, you create a perfect opportunity for cancer cells to escape detection. Have you ever wondered why cancer seems to appear suddenly in seniors who have been healthy their whole lives? Often, it's been growing silently for years, taking advantage of these gaps in immune surveillance. The connection between immune function and cancer is so strong that researchers are now developing cancer treatments that focus on boosting the immune system rather than attacking the cancer directly. To support your immune system while managing pain, consider working with a functional medicine doctor or integrative oncologist who can help you implement immune-boosting strategies. Simple steps like ensuring adequate vitamin D levels, many seniors are deficient, getting 7 to 8 hours of quality sleep, managing stress, and incorporating immune-supporting foods like mushrooms, garlic, and berries can make a significant difference. I've seen remarkable improvements in immune function markers when my patients implement these changes while reducing their NSAID dependence. The third concerning effect is digestive system damage and microbiome disruption. We used to think the digestive system was simply for processing food, but groundbreaking research over the past decade has revealed that your gut microbiome, the trillions of bacteria living in your intestines, plays a crucial role in cancer prevention. Daily NSAID use is particularly damaging to this system. A comprehensive study from Harvard Medical School found that seniors taking NSAIDs daily for more than 3 months had significantly altered gut bacteria compositions with fewer beneficial bacteria that produce short-chain fatty acids, compounds that have been shown to suppress cancer cell growth. Additionally, NSAIDs can cause micro-damage to the intestinal lining, creating tiny ulcerations that may not cause noticeable symptoms, but increase inflammation and create entry points for toxins. This is especially problematic because 70% of your immune system resides in your gut, so damage here has double consequences. It impairs your cancer surveillance system while simultaneously creating an environment where cancer cells can thrive. What's particularly alarming is how this affects colorectal cancer risk. A study published in the Annals of Internal Medicine found that seniors who took NSAIDs daily for more than 5 years had a 60% higher risk of developing right-sided colon cancers compared to non-users. These right-sided cancers are often more aggressive and detected later than left-sided colon cancers. Have you or your doctor been monitoring for these specific risks if you're taking daily pain medication? To protect your digestive system, consider adding a high-quality probiotic specifically formulated for seniors. Look for strains like Lactobacillus rhamnosus and Bifidobacterium lactis, which have been shown to help restore gut barrier function. Consuming fermented foods like yogurt, kefir, and sauerkraut can also help maintain a healthy microbiome. If you need to take NSAIDs, taking them with food and staying well hydrated can reduce their impact on your digestive tract. Some of my patients have found tremendous relief by working with a pain specialist to develop a comprehensive approach that reduces their need for daily NSAIDs. Approaches like targeted physical therapy, acupuncture, and mind-body techniques like meditation have strong evidence supporting their effectiveness for chronic pain. The fourth dangerous effect involves hormonal disruption and cellular stress. As we age, our hormonal systems become more vulnerable to outside influences. Daily NSAID use has been shown to interfere with hormone metabolism, particularly estrogen and testosterone, which can create imbalances that promote cancer growth. A study from the University of California found that postmenopausal women taking NSAIDs daily had 27% higher estrogen levels compared to non-users, potentially increasing breast cancer risk. In men, certain NSAIDs can lower testosterone and increase estrogen, creating hormonal conditions that may promote prostate cancer growth. Beyond hormonal effects, NSAIDs create oxidative stress at the cellular level. When taken occasionally, your body can manage this stress, but daily use overwhelms your natural antioxidant systems, especially as they decline with age. This oxidative stress damages DNA and cellular components, which is a known trigger for cancer initiation. What makes this particularly concerning is that these hormonal and cellular changes happen silently. You won't feel them happening. By the time symptoms appear, significant damage may have already occurred. This is why proactive prevention is so important, especially for seniors who have been taking NSAIDs daily for years. To combat these effects, focus on supporting your body's natural detoxification systems. Cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts contain compounds that help your liver process hormones properly. Antioxidant-rich foods like berries, dark chocolate, and green tea can help combat oxidative stress. For my patients who need to continue some level of NSAID use, I often recommend N-acetylcysteine, NAC supplements, which help restore glutathione, your body's master antioxidant that declines significantly with age. A functional medicine doctor can test your oxidative stress levels and hormone balance to create a personalized plan for your situation. Finally, the fifth and perhaps most insidious effect is the masking of cancer symptoms. Pain is often one of the first warning signs of several types of cancer. When you take pain medication daily, you may be inadvertently silencing these important alarm bells. Many of my elderly patients who were diagnosed with advanced cancers reported that they had been experiencing mild pain for months or even years, but attributed it to aging or arthritis and managed it with daily NSAIDs. By the time other symptoms appeared that couldn't be explained by aging or masked by medication, their cancer had already progressed to later stages. This symptom masking effect is particularly dangerous with cancers that are already difficult to detect early, like pancreatic, ovarian, and certain types of lung cancer. These silent killers often don't cause noticeable symptoms until they've reached advanced stages, and if the subtle early warning signs are further masked by daily pain medication, the opportunity for early intervention may be completely missed. A recent study from Memorial Sloan Kettering Cancer Center found that seniors taking daily pain medication were diagnosed with cancer at later stages than non-users, even when controlling for all other risk factors and screening practices. How can you protect yourself from this hidden danger? The most important step is awareness and vigilance. If you're taking pain medication daily, it's essential to maintain regular cancer screenings appropriate for your age and risk factors. Don't assume that new or changing pain is simply related to your existing condition. Track your symptoms carefully and report any changes to your doctor. Consider medication holidays, planned breaks from NSAIDs with your doctor's approval, which can help unmask any symptoms that might be hiding. Many pain management specialists now recommend cyclical approaches rather than daily use, which can reduce both side effects and the risk of symptom masking. Now, I want to be absolutely clear about something important. I am not telling you to stop taking your prescribed medications. That could be dangerous and is never something you should do without medical supervision. What I am advocating for is informed decision-making, appropriate monitoring, and exploring complementary approaches that might allow you to reduce your reliance on daily NSAIDs while still managing your pain effectively. What alternatives exist? The good news is that we now have more options than ever for managing chronic pain in seniors. Targeted physical therapy programs designed specifically for elderly patients have shown remarkable results in reducing joint and back pain with minimal side effects. Gentle movement practices like Tai Chi and water-based exercises provide pain relief while actually strengthening your body's natural defenses against cancer. Mind-body approaches like mindfulness meditation and guided imagery have been validated by research from institutions like Harvard and Stanford as effective pain management strategies that can reduce medication needs. For many of my patients, topical pain relievers have provided significant relief with much lower systemic absorption and fewer side effects than oral medications. And for those with severe chronic pain, working with a pain specialist to develop a comprehensive, individualized approach often yields better results than relying on daily NSAIDs alone. I've seen firsthand how making these changes can transform lives. Remember Eleanor, whom I mentioned earlier. After her diagnosis, we worked together to completely overhaul her pain management approach while she underwent cancer treatment. By incorporating many of the strategies I've shared today, she was able to reduce her NSAID use by over 80% while actually experiencing better pain control. More importantly, her inflammatory markers improved, her immune function strengthened, and she responded better to cancer treatment than many patients in her situation. While I can't say for certain that these changes were responsible for her positive response to treatment, the scientific evidence strongly suggests they played a role. Another patient, Robert, had been taking ibuprofen daily for 15 years for arthritis pain. After learning about these risks, he worked with a functional medicine doctor to address the root causes of his inflammation while gradually reducing his NSAID use. Within 6 months, routine screening found a small, early-stage kidney cancer that might have gone undetected for years if he had continued masking his symptoms with daily pain medication. Because it was caught early, he required only minimally invasive surgery and has remained cancer-free for 5 years now. These stories illustrate an important truth. It's never too late to make changes that can protect your health. Even if you've been taking NSAIDs daily for decades, reducing your use now and implementing some of the protective strategies I've shared can still make a significant difference in your cancer risk and overall health. Let me take a moment to address some questions you might have. What if you absolutely need daily pain medication to function? In these cases, work with your doctor to find the safest option at the lowest effective dose, and be extra vigilant about cancer screenings and monitoring for warning signs. Could occasional NSAID use cause these same problems? The research suggests that the risks are primarily associated with daily, long-term use. Taking an NSAID occasionally for a headache or temporary pain is much less concerning. Are all pain medications equally problematic? Not necessarily. Different NSAIDs have different risk profiles, and non-NSAID pain relievers may have different sets of concerns. This is why personalized medical advice is so important. The key takeaway is this: daily NSAID use may be providing relief for your joint pain, backache, or headaches, but it could be simultaneously creating an internal environment where cancer cells thrive while masking the warning signs that might otherwise alert you to a problem. By understanding these risks and taking proactive steps to mitigate them, you can continue managing your pain while protecting yourself from hidden cancer dangers. I want to thank you for staying with me through this important information. If you found this video helpful, please give it a thumbs up and share it with someone you care about who might benefit from this knowledge. Remember to subscribe to our channel for more evidence-based information on cancer prevention and treatment specifically for seniors. We release new videos every week, covering everything from nutrition and exercise to the latest advances in cancer care. Before I close, I want to leave you with this thought. Knowledge is power, but only when paired with action. The information I've shared today isn't meant to frighten you, but to empower you to make informed choices about your health. Small changes, consistently applied, can make an enormous difference in your cancer risk and overall well-being. You deserve to enjoy your senior years with vitality and health, and making smart decisions about pain management is an important part of that journey. Remember, it's never too late to make changes that protect your health and possibly even save your life. Thank you for watching, and I'll see you in our next video.